Thank you all so much for being here. I am so grateful for your presence. April is Minority Health Month, and I'm so honored to be joined by our Director of the Health and Human Services, Dr. Bridgers. We also have with us Dr. Keisha Davis, our county's Chief Health Officer. We also have Pat Grant with the African American Health Program. Hina Mehta with the Asian American Health Initiative, Marcela Campoli, Mariana Sarani, and Patricia Rios with the Latino Health Initiative, Janelle Martinez, Ann Marcore, and Jacqueline Jackson with the Black Physicians Healthcare Network, and Dr. Cara Grant and Dr. Troy Body, community health advocates who recently published their novel, Intersectionality in Health Education. Thank you all so much for joining us. Your efforts to advance health equity here in the most diverse jurisdiction in the state of Maryland is recognized and appreciated. This year's theme for Minority Health Month is Be the Source for Better Health, improving health outcomes through our cultures, communities, and connections. As the council's lead for eliminating disparities in public health, I'm so proud that our county has continued to make advancements in this arena. And so much so that we have now been ranked as one of the healthiest counties in the state of Maryland. I think that deserves a round of applause. However, with celebrations, there's also a reminder that there's more work to do. Montgomery County is home to 4 of the most diverse cities in the country. And so today's proclamation is a reminder that we still have some disparities that require our attention, but the list is certainly not comprehensive. I want to thank our minority health programs, which include the African American Health Program, the Latino Health Initiative, the Asian American Health Initiative, and the Black Physicians Healthcare Network. We are positioned with practical tools and resources to tackle these disparities and ensure that all of our residents have the same access to quality health care, regardless of their race, ethnicity, or zip code. And so I want to ensure that our speakers get an opportunity to talk and address these issues before we read the proclamation. So I'm going to start by calling up Dr. Davis.
Thank you, Councilmember Sayles, and thank you to the entire council for the recognition of April being Minority Health Month. As was mentioned earlier, diversity is one of Montgomery County's greatest strengths. We are the largest, most diverse, and healthiest county in the state of Maryland, and we have not left our minorities behind in doing that. And yet, we still know that there are disparities that exist. When we look at years of life lost, when we look at days of absence, when we look at life expectancy, there is a disparity, especially in our Black and brown population. And we at the health department, and I know with the support of the council, who has declared racism as a public health crisis, is emphatic about working on those disparities and eliminating them. And I want to commend many of the partners that are here with us today, the African American Health Program, the Asian American Health Initiative, the Latino Health Initiative, the Black Physicians Healthcare Network. Much of the work that they do, they are our hands and feet into the community in order to interact with folks directly, to do the good work that we know needs to happen on a one-on-one basis to help eliminate disparities. So we thank you for the recognition. We recognize there is much more work to be done. So thank you.
Thank you, Dr. Davis. Now we will hear from Ms. Pat Grant, Dr. Grant, with the African American Health Program.
Thank you, Councilmember Sayles and the entire County Council. As Dr. Davis said, we live in a county that puts a lot of emphasis on diversity, which is a good thing, but the other emphasis is on public health. So I am proud to be a resident. I'm proud to be a member, a resident. I'm also proud to be a member of the African American Health Program, where we focus every day on trying to eliminate the many disparities that impact our population, but the residents, and feeding into that overall goal of eliminating disparities all over. So one of the things that we want to emphasize, prevention is important. Also, we need to take the blame away from the individual, because there are many other risk factors that impact how a person's health outcomes cannot be as positive as they should be. But anyway, that's what we're here to do, and with the county council and the county's support, we can get it done. Thank you.
Thank you, Dr. Grant. Now we will hear from Marcella Campoli. And is someone else joining? Okay, thank you.
Honorable council members, Councilmember Sayles, thank you for inviting us here today for this important proclamation recognizing Minority Health Month and the promotion of the theme, Be the Source of Better Health, Improving Health Outcomes Through Our Cultures, Communities, and Connections. In a county where 1 out of 3 residents are immigrants and almost half the population belongs to minority communities, it's crucial to acknowledge their vital role in Maryland's economy, culture, and communities. The 2023 Community Health Needs Assessment conducted by the Montgomery County Department of Health and Human Services shed light on the diverse array of health needs within these communities. These needs include access to essential services such as behavioral health and substance use disorder treatment, quality primary and dental care, and culturally and linguistically competent health care services. While this report serves as a foundation for targeted intervention and future health initiatives, we must not overlook the challenges faced by our students. This crisis presents itself in our communities and schools under the triple threat of substance use, violence, and bullying. As we confront and address these challenges as a community, our commitment to health equity must remain steadfast with linguistically and culturally proficient programs aiming to heal and transform. We must ensure that every community member, regardless of background, country of origin, skin color, or gender identity, has access to the resources and support they need. Together, we should continue to build a healthier, more resilient community for all. I trust that with this proclamation, everyone commemorates the importance of universal health access and celebrate the prospect of good health for all. Thank you.
Thank you, Ms. Campoli and Ms. Sarani from the Latino Health Initiative. Now we're going to hear from Hina Mehta with the Asian American Health Initiative.
Thank you, Councilmember, for the opportunity. I think my colleagues already, talked about the diversity in this county, and as an Asian American group, we are always considered a model minority. But when it comes to reality, it's not true. Always, when especially it comes to the health disparity, when we break it down, there are 10 plus Asian subgroups, and everyone has an individual need, language need, and their health needs. So I just want to say that thank you to entire county council members as well as county executive for all their support that is provided through DHHS to serve our communities. And pandemic has, if something pandemic has taught us to how to work collaboratively, and I can say that Asian American community is very grateful for this support that has been given to us. So thank you.
Thank you, Ms. Mehta. Now we will hear from Ms. Jacqueline Jackson with the Black Physicians Healthcare Network. We also have Janelle Martinez and Mark Correa with the Black Physicians Healthcare Network.
We are grateful to Councilmember Sayles and the entire County Council for inviting us to be a part of this special event celebrating Minority Health Month. The National Center for Children and Families is honored to be a source for better health outcomes for Blacks in the county. On behalf of the practitioners, community partners, and patients of our Black Physicians and Healthcare Network program, thank you. Thank you for your continued dedication to understanding the needs of this community and acknowledging the work our group in ensuring that in this healthy county, Blacks can enjoy equitable health and wellness opportunities. Thank you.
This work cannot be done alone, and we cannot do this work in silos. And so I am so glad that we have all of our minority health groups here present to honor and raise awareness about this important month, to ensure that we're doing all that we can, especially in the midst of budget season, to ensure they have the resources they need to provide culturally competent care to our diverse communities. And so now I will read this proclamation on behalf of the council. Whereas National Minority Health Month is a necessary time to raise awareness about the health disparities that disproportionately affect communities of color. Whereas its origins date back to 1915, when civil rights pioneer Booker T. Washington established Negro Health Week to educate Black communities about proper health practices. Whereas this month we focus on the negative impacts of stress and emphasize how stress management can improve mental and physical well-being and minimize health-related issues. Whereas this year's theme, Be the Source for Better Health, improving health outcomes through our cultures, communities, and connections, highlights the need to understand the social determinants of health for racial and ethnic minority populations, impact their overall health. Whereas data shows that racial and ethnic minority groups throughout the United States experience higher rates of illness and death across a wide range of health conditions, including diabetes, cancer, HIV/AIDS, hypertension, obesity, asthma, and heart disease, when compared to their white counterparts. Additionally, the life expectancy of non-Hispanic Black Americans is 4 years lower than that of white Americans. Whereas centuries of racism have had profound and negative impact on communities of color, creating significant inequities in access to social and economic benefits, such as housing, education, wealth, and employment, commonly referred to as the social determinants of health. Whereas Montgomery County's minority health programs, the African American Health Program, the Latino Health Initiative, the Asian American Health Initiative, and the Black Physicians Healthcare Network provide culturally and linguistically appropriate services to improve health outcomes and alleviate health disparities. Whereas Montgomery County is one of the healthiest counties in Maryland and in the United States, according to the annual county health rankings, Montgomery can address disparities in public health by increasing the capacity and number of providers in underserved communities, addressing the social determinants that contribute to health disparities, investing in school-based health and wellness centers, expanding the oversight capabilities of the Office of Racial Equity and Social Justice, and continuing to partner with the increased funding for our minority health programs and initiatives. Now, therefore, it be resolved that the County Council of Montgomery County, Maryland hereby recognizes Minority Health Month as a critical time to proactively make progress toward reducing global and local health disparities for our minority groups. Presented on this 23rd day of April in the year 2024 by Councilmember Sayles and members of the Montgomery County Council. Thank you. And I'd be remiss if I did not announce our new Public Health Director, Ms. Nina Ashford. Thank you.